Okay, so let's get started. We have a earlobe here that's large, and we have a nice gentleman who had otoplasty done somewhere else, but the lower part of the ear was not addressed. So what we need to do is to make it smaller and to pull it backwards this way as well. Don't have to do a lot, just enough to make it look more appropriate. That's what we have to do. So, and the same thing on the other side. Let's go take a look. As you can see right there, same thing, sticking out. So we're gonna push it back a little bit and make it smaller as well. So we'll do the drawing, we'll show you the drawings, and then we'll get started. So today we are doing a horizontal reduction of the earlobe. You can do horizontal or you can do vertical, and I'm going to show you in a second what is meant by it. And there are two different approaches. Both work well depending on the situation with the ear. So I'll tell you why we are choosing a horizontal excision as opposed to a vertical wedge excision. So let's take a look. Okay, so as you can see right here, so this is the horizontal excision this way. The vertical wedge would be making it right this way and just narrowing it together. Both can be combined as well. I usually do it the vertical if it is, really long this way, and also if there's an existing vertical line or a crease. If there's a vertical crease here, you can use that crease to hide your scar, and it works out really well right there. If you don't have that, then you can do a horizontal where you can see, let's go to magnification right there, so you can see much better over here. And then let's show you the back as well, in the back as well. There we go, right there. In this case, we need a setback. We need to get it going backwards as well. So if you notice, we are taking small amount from the front and a much bigger amount right there from behind. So that's going to set the ear backwards as well, right there, like this. And that's exactly what we need. And then we can measure on both sides to make sure it's symmetric. Let's get started. So remember the horizontal and the vertical. So the markings are done. As you can see, we drew an ellipse, goes all around this way. And then we have to do the markings to be exact. So this 10 millimeters right here, 10 from intertragal notch to the junction with the face and the cheek area, 20 from the antitragals all the way to the inferior aspect, and then the ellipse in the anterior aspect is 7 millimeters, but in the posterior aspect, show you in 1 second, is 12. The differential is to pull the ear lobe backwards so that it sets a little like this. And just pull back a little, it looks much better. We'll do the exact markings on the other side and we are good. So these are the earlobe excisions, and we have them marked, as you can see, and very symmetric on both sides and came out very nice. Now let's take a look at the ears. There we are, the brand new ear. I think I want to trade my ears with him. Yeah, they look really cool. So, well, all joking aside, you can see that they have been set back as well. And that was because we took more from the posterior aspect. If you take more from the posterior, there's a pullback effect, and that's what we are seeing. Let's go to the other side and same thing. Pull back, looking so much better and appropriate. So as you can see, the incision goes along the natural line, and once it heals, you can't even tell it. It looks very inconspicuous. So very excited and cannot wait to show you the final result.